So my name is Loren. I work here at Red Nose as the National Education and Health Promotions Manager. And my background is as a midwife. I have worked very closely in all departments, so from pregnancy right through to birth, postnatal and special care. And I've also worked in sort of early parenting centres as well. So I do a lot of parent education and antenatal education as well. So I'm excited to be here to represent Red Nose today.
Excellent. And I've had a lot of my followers messaging me questions about safe pregnancy, and basically I'm pregnant at the moment with my first baby, so I have a lot of questions as well. I know a lot of pregnant women are very nervous, especially with their firsts. What are your main tips for pregnant women and starting off on their pregnancy journey?
Absolutely. So when you're starting off, I think it's really being confident in the type of care choice that you've decided on. So, and really building that relationship and rapport with your healthcare provider. So whether that's an obstetrician, a midwife-led care, or shared care GP, building that relationship just means you feel very comfortable and relaxed to ask any of those sort of burning questions that, you know, you might be keeping you awake in the middle of the night. But I don't know about you, but I know when I used to go through my doctor's doors, it was like amnesia. As soon as I walked through, all of those questions would be gone. So one of my key tips is just to write down those sort of questions as they come up and take the time and feel confident to ask those in your appointments.
Yeah, I'm definitely the same. And every time I go to an obstetric appointment, I go blank. I completely forgot all my questions when I went in the other day, so I definitely write mine down now. So for women progressing with their pregnancy, things are going well, they've got, you know, either a midwife or an obstetrician that's looking after them. What are things that they can do at home in their everyday life to promote a safe pregnancy? So what are things that they should be avoiding or things that they should be doing to continue a safe pregnancy?
Well, if you jump on our website, we've got some great resources. So at www.rednose.org.au, and you can click onto the sort of healthier and safer pregnancy tips. But there are really mainly three things that I would encourage people to sort of focus on, and that would be to monitor your baby's movements. Start sleeping on your side from 28 weeks if you haven't been doing so beforehand, and also to quit smoking, or if your partner is smoking as well, for them to go on that sort of quit journey as well.
Yeah. I started sleeping on my side, I think, from the moment I had a positive pregnancy test. Just the habit of it, because I'm such a tummy sleeper, and I just knew that I would struggle. And it's strange. Now it's just become the norm, sleeping on my side. And I know a lot of women do struggle with it. So another good tip is get a good pregnancy pillow if you haven't already. And definitely helps with getting into a good position at night time.
Absolutely. So, I would encourage starting earlier than the 28 weeks because we know that by sleeping on your side from 28 weeks, it can reduce the risk of stillbirth by 50%. So it's a really quite a powerful thing for you to do. And yes, pillows I would highly recommend. They can be expensive. So even just a rolled up towel just behind your back. So if you're starting to go onto your back, you're not fully flat. So the reason why it's so helpful is that if we do sleep on our back later in our pregnancy, because Bubs is nice and grown, they end up compacting one of your main arteries. So the blood flow to mum is reduced, and that can have an impact on the blood flow that ends up going to placenta and baby. So staying on your side is great. If you do wake up on your back, please don't panic. Just go onto your side, and I'm sure your little one will end up giving you some kicks in frustration, but you're squishing them again, and you can reassuringly go off to sleep.
Yes, I know my baby starts kicking every time I roll onto my side to reposition. Yeah, good little kick to say that she's getting into her position now. So it's definitely reassuring. So for a lot of my followers, they actually don't know that my baby was diagnosed with a single artery cord. So she's at risk of being small to develop, and it's actually quite common. So 1 in 100 pregnancies have a single artery cord, which I didn't know about, but my obstetrician has definitely spoken to me about monitoring my baby's movements and making sure that I understand her pattern and what's normal for her. What are some tips on monitoring your baby's movement? And what is deemed, I guess, normal for everyone will be different. So is there something that we should be going by?
Yeah, so a while ago, we used to sort of try and focus on counting the kicks, and that was sort of the recommendation and guide that we sort of started to promote. But we do know that every baby is different. You know, some like to kick lots, you know, so you may have a baby who likes to sort of move and bounce around in there, and you might have some of the more chilled out babies. So it's really more important about getting to know what is normal pattern for your baby. That is number one key. So as you sort of get closer towards the trimester, you'll start to notice some patterns of your baby. So do they like to have a mad half hour after breakfast time? Do they keep you awake in the middle of the night time? You'll start to learn their awake patterns. Now, this can be really helpful because as again closer to birth, this will be their awake patterns when they come out of the womb too. So it's kind of training you up to maybe having those nighttime toilet trips at the moment, which can be very frustrating, but they may turn into nighttime feed time. So it's sort of priming you for that, but it's also showing you that baby's feeling quite well and their well-being is really great because their regular movements. But when those movements change, that's something that you really want to notify your healthcare provider about. So whether it be there's been a large increase in movements or if there's been a decrease in movements, if you've noticed that, I would strongly recommend just to contact your care provider. So whether that's your obstetrician, your midwife, or your GP, or perhaps you're at the stage where you've been asked to start contacting the birth suite directly and having a chat to them about what you're noticing, because we do know that with stillbirth, 50% of women who experience that have noticed either a decrease or increase in movement beforehand. So never ever be afraid to pick up that phone. I've spoken to many families who feel embarrassed or nervous to give us a call, even if it's in the middle of the night. That midwife on that ward has been paid to be there, and she wants to hear these phone calls because nothing more reassuring than getting you in as early as we can and putting you on that monitor. So yeah, don't be afraid.
Yeah, no, that's, it's a great tip. And as a nurse myself, I always tell my patients is that you know your body better than anyone else. And if you think that there's something wrong or something's changed, then be your own advocate and speak up for yourself. And you should. The best case scenario is that we turn you back and say everything's okay. Like, that is what we want.
Absolutely.
So pregnant women out there should definitely not be embarrassed or shy or think that they're, you know, like, oh, I don't want to bother someone, that this is probably going to be nothing. The best case scenario is you go into the hospital, get checked out, or a midwife checks you out, your obstetrician checks you out, and then they turn you around and say, everything's good, you can go home now. That's what we want.
Absolutely. It is, definitely. And I really like your point there about being your own advocate, because when you become a parent, you really have to advocate for your babies and your children. But that journey actually starts in pregnancy too. So even if you're thinking, oh, I'm too, nervous or embarrassed, or, I don't want to bother anybody, when you think of it as being the voice of your baby, that inner strength will shine through and you'll pick up the phone. So yeah.
Yes. I know your mum journey starts the minute you fall pregnant, and that's something that I've learned along the way, is that I'm a mum before my baby even arrives, and I'm advocating for her and for her. So we've touched on stillbirth. So obviously now I'm in my 3rd trimester. Is there any time during a pregnancy where stillbirths are more likely to happen, that women should be a little bit more cautious around? Because, it's definitely been something that's on my mind, and we don't want to, obviously, women who are pregnant, we don't want to stress anyone out or panic anyone, because that's the last thing that we want. But I think education and knowledge is power. So when should we start sort of being a little bit more cautious and a little bit more aware? What time frame?
I think as soon as you are able to start noticing your baby's patterns of movement, you're wanting to be aware from that point, and for some people, they start to notice that quite early. Other people, it can be a little bit later on, and that's okay. As you sort of reaching that sort of 28 sort of week mark, you will definitely start to pick up there is a pattern, and keep always monitoring that as you move forward. Linking in with your primary carers, and trying to attend as many of the appointments that have been scheduled for you as you can is another great thing that you can do, because that's sometimes where we pick up things that might be sort of underlying that you may not be able to visually see. So we monitor blood pressure, we monitor the baby's growth, heartbeat. So anything that sort of starts to ring some alarm bells will be hopefully picked up in some of those appointments. And then we can order some extra investigations. So it might be an extra ultrasound. They may start to increase the number of appointments you have. So yeah, attending those appointments are going to be really important. If you're feeling like you're needing some more information about being pregnant and safer pregnancy, and also transitioning into that parenthood, I would also be encouraging people to link into their antenatal classes, if that's possible. Often hospitals will run their own, otherwise there are some private ones that are run as well. And just sort of gaining that extra information and having somewhere to go to with some additional questions can be really useful too.
Yeah, I booked mine in. Mine are all booked in the new year and very excited. So I'm having my baby at my work. So I'm super lucky that I have already connected to a lot of the midwives. But I think having that antenatal class and being in an environment where you're also around other women going through the same thing is very empowering. And you get so many tips and tricks from other women as well. So I think also talking to people in the same situation as you, first-time mums, I think, I've been talking to a lot of my friends that have had babies before me, and I've learned so much from them. But I know on their website have a lot of information. So you've also mentioned to talk to your primary healthcare providers, whether it's midwife or your obstetrician. Is there anything else that you wanted to touch on before we sign off? I think that a lot of my that I had.
Great. I think probably then the only additional things are, again, just seeking out support with quitting smoking if that's something that a journey that you still need to go on. There's no too late in your pregnancy, okay? So it's never too late to quit. And linking in again with your provider as to what best method is for you will be the thing to do. Also in the summer months, we're about to hit holiday season, so sometimes we're sort of tempted by others a little bit more when it comes to sort of alcohol. So really just trying to be mindful that there is no research around alcohol and their link to stillbirth. So we do encourage it to try and stick to 0, which is the current recommendation. So try and have some alternative fun mocktails up your sleeve.
Yeah, no, I have so much fun experimenting with mocktails. I think every mocktail in every bar in Perth at the moment. And yeah, you don't drink when you're there. As you said, there is no safe amount. So, and I know it's in particular very hard during this time of the year and everyone's out partying and celebrating. But it's only 9.5 months of your life. So it's a short-term thing. The other thing to mention is for anyone that's following that wanted more support on bereavement or miscarriages. I know I've brought that up and spoken about it in my experience. Red Nose have so many supports. They offer bereavement care and bereavement support, and they've got a hotline. I know I have been on the phone with them, and their support is amazing. It's definitely helped me with my journey. And also on a separate website is where there is all the safe pregnancy information. And I will be doing another video on safe sleep soon. So for those following along, that will be coming up.